Hello, so this is Diona Online TV and we are back at it again, and I am your presenter Naomi, and with me I'm joined by a handsome man who's going to introduce himself and where he's coming from. What is your name and where you're coming from, sir?
Mr Mwape, I'm Public Health Officer for Nakonde Digital Office.
Okay, he's Dr. Mwape. The reason being that we have invited him to come on the platform is to explain to us the issues about COVID-19, what is trending on ground recently, seeing that people have become reluctant in Nakonde, thinking either COVID-19 is there or it's not there. Can you please explain to us the issue on ground concerning COVID-19?
Yeah, COVID-19, I can certainly say COVID-19 is here with us, and we have continued with the screening activities for the travelers, especially those that are coming from across the borders. We are screening everyone. In clinics also, like Nakonde Urban, even at the district hospital, we are actually screening. So people should not relax and say COVID is gone. In fact, now, when you look at the statistics we are getting from Ministry of Health, it is showing that the new wave, they are calling it the second wave of corona, has come actually with a lot more virulence. That is, it is a lot more fatal. We have seen a lot of people that have been brought to facilities already dead, or just pronounced dead upon arrival at the facility. So that indicates to us that COVID-19 is actually there, and we should not actually relax. We should continue. I've been talking to a number of people in various fora, and what I've been able to emphasize is to tell them that they needed to alert and observe the public health recommendations at household level, because if I can observe these the recommendations, my wife does the same, my children do the same, then we are assured that even as we go into town to do whatever business that we have, we will observe such instructions and recommendations. And if 2, 3, 4, 5 families start to observe such, then we can be assured of a community that is actually working hard to ensure there is no spread of the deadly disease, which is called coronavirus or COVID-19.
Okay, so as we have heard from Dr. Mwape, COVID-19 has come back with the second phase with us, and we are having it right here in Nakonde. So just to speak, what are the public recommendations that are given to the public to do if they want to distance themselves away from COVID-19?
Okay, to do that, first I would want to emphasize the point of transmission of corona. I should first start by saying there are two two broad methods of the spread of coronavirus. The first one is droplet. Droplet means that as I'm talking, as I'm coughing, as I'm sneezing, uh, or maybe as I'm singing, I tend to release small droplets that will carry the virus. And these droplets have the ability to fly for a distance of about 1 meter to 2. Then they'll drop and they'll be ineffective. But then, if I'm not masked, then I have the ability to inhale, to breathe in those small droplets, and I'll get the infection. So that is one major transmission mode, that is by a droplet. The second aspect is by contact. What do we mean when we say contact? We mean all those aspects that will bring ourselves in contact with the virus. One of them would be a handshake. The second one would be hugging. The third one would be maybe kissing. The other one might be in contact with surfaces such as counters where we do the transactions, we go in the bank, we go in the shop. Sometimes even the money that we are getting, which is fomite, it's a material that we are touching. You should realize that the virus has the ability to survive on certain surfaces for long periods, close even to about 8 days or so. So meaning that if we touched those surfaces, even the door handles as we enter the rooms, do we know how many people have touched those door handles? That is why it is important that when we understand the two modes of transmission, then we can know how well we can prevent ourselves from catching the infection. So now I'm coming back to how then can we prevent the contraction of the virus so that we get COVID-19, the viral disease. We have known that there is droplet, there is also contact. So if I'm to talk about droplet, then I would say ensure that people put on their masks whenever they are in a group, whenever they go where there's a group of people, ensure that you are masked. What that means is that as I'm talking, as I'm coughing, I'll not emit those viruses for people to inhale, isn't it? So by use of that, then I'm trying to avoid catching the disease through inhalation, through the droplet. When I discuss contact, what can I do to avoid me catching the virus from contacting with the surfaces and the money, whatever we do? I'll avoid things like greeting by use of handshake. I'll just greet the person. How are you, Noah?
Mayona.
Yona. How are you, Mayona? That is enough greeting, isn't it? Then, when I touch surfaces like the door handles, the tables, the counters, I touch money, I touch what? I will ensure that I thoroughly wash my hands with the soap. If I cannot access water to use for hand washing with soap, then I can as well bank on the hand sanitizer. I use the hand sanitizer, I ensure that I sanitize my hands. I'll also make efforts. If I'm in the business, maybe I'm at a Kantemba Airtel booth. People are coming to do business with me. They are bringing money. I'm giving out money. What I'll do is, after a short while, I'll ensure that I'll sanitize my counter at the booth. I'll use chlorine, 0.5%. Then I wipe out my surface. That way I'll be killing the virus. You see? So that is what we can do to ensure that we are protecting ourselves by contracting the disease through contact. There are also other issues like church gatherings, funerals, weddings, and other activities that will bring a lot of people together. These activities, according to the guideline that we are getting from government, the Ministry of Health, they are telling us to say we should be able to allow some of these gatherings, but then let them take precaution. Let them be cognizant of all the public health recommendations that we have said. When I'm in the public, I'll use a mask. When we are in the public, we should have adequate hand washing stations, hand washing facilities available with soap.